just about 3 hours, Newark will institute a mandatory curfew for these zip codes seeing a surge in COVID-19 cases. It goes into effect at 9 o'clock tonight, 10 o'clock on the weekends. Newark's test positivity rate is now a staggering 19%. Sports in the city now canceled for 2 weeks. Gatherings are now limited to 10 people. For 2 weeks, no visitations to senior housing. And religious gatherings are now limited to 25%. News 4's Gabi Acevedo is live in Newark with what else we're learning about this. Gabi?
Chuck, as you just mentioned, at this point, Newark's positivity rate is more than double the Garden State's at 19%, using a 3-day rolling average. Now, a mandatory curfew will be imposed on 3 zip codes, showing a significant increase in COVID-19 cases. Those 3 zip codes impacting neighborhoods in the East Ward, North Ward, and around Newark Liberty Airport. No one should be on the street after 9 p.m. on weekdays, 10 p.m. on weekends, with the exception of those coming and going to work. All non-essential businesses will be closed at 8 p.m. and restaurants must limit reservations to no more than 10 people. Religious services limited to 25% capacity, and the executive order also imposing a limit on visits to senior housing in order to protect the most vulnerable population. And some tough news for sports all around, as Chuck just mentioned, now canceled at least for the next 14 days, and everyone involved, coaches, refs, and players, needs to get tested before restarting activities. This curfew is something that Mayor Baraka had warned residents about over the past 3 weeks, and he says the time to act swiftly is now.
Our cases are more, and we have a higher rate of infection, and the people who live in this community are more likely to catch COVID-19 than anybody else, and are more likely to die. We may even shut down the drugstores and all those other places as well. Everything. We want it completely shut down in those zip codes.
After December 1st, the city of Newark will reassess the situation on the ground to determine next steps in the battle against COVID-19. Reporting live from the Ironbound in Newark, Gabi Acevedo, News 4, New York.
All right, Gabby, while you're talking about New Jersey, we did just get some new numbers in for New York State showing the positivity rate now over 3%. New positive cases reached almost 4,000. Hospitalizations are also up tonight. Now, as for the city, it is on the verge of a second wave. New York City is seeing its highest daily case averages since late May. The rolling positivity rate up to 2.3%. If it hits 3%, public schools would switch to all remote, as we've been telling you. Now, the 2 neighborhoods with the highest infection rates in the city are on Staten Island, more than double the city's overall rate. All right, with that, we want to bring in News 4's John Chandler, who's live in St. George with the day of action now, John, to fight back on this looming second wave.
Yeah, and Natalie, those numbers you mentioned are alarming to the city. They want to see more testing and more mask wearing here. And to get that to happen today, they made an aggressive pitch.
We're giving out free masks today.
Staten Island's coronavirus cases keep rising.
Those are the location.
The warning is getting out, but is it getting through?
People are not doing it, that's the problem.
Veronica doesn't leave her car without a mask. And to make sure others do the same, volunteers spread out Tuesday, handing out PPE and information about testing. They approach people at shopping plazas and the ferry terminal.
We remind them and we talk to them about it, and so many of them were like, oh, I didn't know.
Some people are uninterested, and those are the folks we most want to reach.
Calling rising numbers a clear warning, Mayor de Blasio hopes outreach here on Staten Island will help reverse rise, like in other hot spots.
We saw ultimately high levels of testing everywhere.
Increasing testing is now a priority.
I think we just have to speak about it more. The more you talk about it, more you say, oh, did you get tested? I got tested. You should get tested. And we're making it everyday language. I think that helps.
Free mask.
Masks help too. Most happily take them, but how many are actually wearing them?
They wear them down past their nose, they wear them under their chin.
Follow the rules to make us safe. It's not about anything else but making us safe.
How is it we are so many months into this and people still aren't, you say, following the rules?
Because they're kids. You know, it's pain in the neck, it really is. You sweat a lot, but you know something, you have to sacrifice.
Stay safe and wear a mask.
Certainly there were a few we saw who declined taking a mask, but just about everybody did take a mask, even those who were wearing them. The reasoning, they'd stuff it in their pocket and keep a spare just in case they needed an extra, or if they saw someone not wearing a mask, they could offer that to someone. The city hopes that sentiment is what starts spreading here around Staten Island. And as far as testing, there are additional sites going up and running here. On Friday, the rapid testing site here at the ferry terminal will get rolling. We're live in the St. George section of Staten Island. I'm John Chandler, News 4 New York.
All right, John, thank you. The number of daily cases in New Jersey has nearly doubled since yesterday. The state's reporting nearly 4,000 new cases of COVID-19. Essex, Passaic, Union, and Bergen counties are seeing the highest numbers of hospitalizations, and hospitalizations are also up now, topping 1,600. They haven't been that high since June. The state's positivity rate is now nearly 8%. Meaning an average of 1 out of every 12 people tested across the state has COVID. In Connecticut, COVID is also surging to alarming new levels. The positivity rate jumped to more than 6% today, and more than 500 people were hospitalized with the virus. Governor Ned Lamont says that number has doubled in the past few weeks. Several hospitals are now restricting visitors at outpatient facilities. Last week, Governor Lamont rolled back reopening plans to what he calls the Phase 2.1.